Dear students, it's lecture about connective tissues, and the first to start to repeating about general histology, about types of tissues. Tissues may be defined as aggregates or groups of cells organized to perform one or more functions. Inside in tissue present not just cells, present extracellular substance too. Four basic types of tissues present in human organism: epithelial tissue, connective tissue, muscular tissue, and nervous tissue. Very important question about classification of connective tissues. Inside in connective tissues, classified four main types. It's blood, connective tissue propria, which include fibrous connective tissue and specialized connective tissue, cartilage and bone. Cartilage or bone formed skeletal connective tissues. On its lecture, I will explain about blood. It's a type of connective tissue, and blood includes more extracellular substance with name plasma of blood. In human, total blood volume near 5 liters if we have 75 kg of weight. Blood include two main parts: form elements, which include the erythrocytes, leukocytes, and platelets, and plasma or liquid phase. On its slide represent main functions of blood. Main function is carrying more very important substances: nutrition material, oxygen, carboxygen, hormones, antibodies, and regulating proteins. Plasma of blood include near 90% water by volume and near 10% of some elements, organical and non-organical substances. Plasma proteins include three main types: albumin, globulins, and fibrinogen. Albumin, very important protein which provides substances, transported substances between some organs, between some tissues. Globulins, alpha, beta, and gamma, very important because provide immune activity and immune protection. Gamma immunoglobulins has name antibodies. Fibrinogen is a protein which after activation change to fibrin and include in process of clot formation. On its picture represent hematocrit. Hematocrit formed after sedimentation and segregation, and after segregation represents three main fractions: plasma, leukocyte, and erythrocytes, visible in its picture. And position of plasma: how many percent include plasma in blood, how many percent include form elements, represent hematocrit. In normal, in human blood, present near 55% plasma and 45% formed elements. Formed elements include three main types: erythrocytes, leukocytes, and thrombocytes or platelets. Erythrocytes provide very important function: changers of gases, oxygen, carboxygen, include special protein hemoglobin, and it's a bonding protein, may a function of hemoglobin bind oxygen or carboxygen, and form special color of erythrocytes, red color. Erythrocytes near 7 to 8 micrometer in diameter approximately 7.2 micrometer, and its form element lose nucleus before final mature differentiation. And early form of erythrocyte has name reticulocytes. In reticulocytes present rough endoplasmic reticulum and Golgi apparate and continue process formation of hemoglobin. In erythrocytes present two types of hemoglobin, may be HbA and HbF. HbA are present more after delivery and form its new hemoglobin in first one half of year after delivery, and second type HbF represented in period of pregnancy, and it's a process of bonding oxygen more active in HbF. In normal, near 80% is biconcave shape erythrocytes, but may be present in other forms of erythrocytes. In normal, near 80% erythrocytes has size 7.2 micrometer, but 20% may be more height by size. It's macro erythrocytes or micro erythrocytes, more smaller by 7.2 micrometer. It's a specific combination of size of erythrocytes has name anisocytosis. Leukocytes or white blood cells with nucleuses always, and it's a really cells in human blood, because erythrocytes without nucleuses, it's a non-cellular structure, or thrombocytes without nucleuses because formed after destroyed some parts of cells. In general, from 6 to 10 multiply 10 degree 9 in 1 liter present leukocytes in normal. Erythrocytes near 3.4 to 4.5 multiply 10 degree 12 in 1 liter. And leukocytes to divide on two main groups, granulocytes and agranulocytes, according to the content in cytoplasm granules. It's a very good scheme show to you types of leukocytes, present granulocytes and agranulocytes. Granulocytes to divide on three main groups according to color or to staining. After use special staining of blood, spacement Romanovsky-Ginza. Here represent three types according to color of specific granules: neutrophils, basophils, and eosinophils. Neutrophils to divide on three main groups: juvenile, band, and mature. Special shape of nucleus can represent and can recognize which is type of neutrophils. Juvenile include oval shape of nucleus, band include nucleus with C-letter shape, and mature include nucleus with some segments from 3 to 5. Agranulocytes, two types of cells, monocytes and lymphocytes. Lymphocytes to divide on two types of lymphocytes, T and B lymphocytes. I told on previous slides about types of granulocytes. Here on this slide you can see types of granulocytes, neutrophils, eosinophils, and basophils. Neutrophils are the most abundant leukocytes in the blood. Neutrophils is a first line of protection of organism because neutrophils provide phagocytosis of bacteria, viruses, and in other agents. In neutrophils present specific granules which contain alkaline phosphatase and bactericidal cationic proteins which provide protection from bacteria, and phagocysteines. It's a specific enzyme which protects from bacteria too. And specific granules provide specific color of neutrophils. Eosinophilic granules contain lysosomal enzymes. In other words, it's lysosomes. Eosinophils include histaminases, very important enzymes which release after inflammation, after allergic reactions, and always in formed invasions of parasites. Always we have in leukocyte formule increased eosinophils in its cases. Basophils are very interesting cell because provide metachromasia. It's a change color of basic histological dyes from blue to purple color. In basophils present two types of main elements in specific granules, heparin and histamine. Heparin and histamine are main elements of inflammation and provide allergic reactions. Agranulocytes, cells without granules in cytoplasm, specific granules not present, but lysosomes present more. Because agranulocytes helps to immune protection, lymphocytes and monocytes. Lymphocytes to divide on two major groups, T cells and B cells. In human, near 80% is T cells and near 20% B cells. T lymphocytes or T cells to divide on three groups, T cytotoxic cells, T killer cells, T helper cells, and T suppressor cells. T killer cells are very active and provide phagocytosis. It's a first step of immune protection. T killer cells very active to cancer cells. T helper cells helps to provide and form plasma cells after antigen intervention and formed antibodies to specific antigen help to its process. T suppressor cells after immune reaction decrease immune provide formed not active T and B lymphocytes. B lymphocytes or B cells differentiate to plasma cells which produce antibodies very important to protection to specific antigens. Monocytes, very large cell, very good visible on histological specimen of blood. And inside in monocytes present more lysosomes, eosinophilic granules in other words, and its cells stay in bloodstream near 48 to 72 hours, and then cells migrate to connective tissue and represent new cell form macrophages. In other words, monocytes precursor of macrophages in connective tissues. Leukocytes in human organism can formed by specific leukocyte formula. And on its slide, you can see amount of granulocytes and agranulocytes. How many percent include agranulocytes, lymphocytes? From 20 to 40%. Monocytes from 3rd to 11, eosinophils 0.5 to 5%, basophils 0 to 1%. Neutrophils to divide on three main groups: juvenile 0, 1, band from 1 to 6%, and mature 47 to 72%. Its leukocyte formula in normal. In pathological stages, maybe change amount of percents in some groups, and in inflammation process always increase amount of neutrophils, juvenile and band forms of neutrophils. Platelets. Platelets, another name thrombocytes, formed from megakaryocytes in red bone marrow. After destroyed some parts of megakaryocytes near with sinusoid capillary, formed platelets and megakaryocytes of very large cell, formed after endomitosis and in its cell present very large nucleus. And all processes formation of platelets will be activated by thrombopoietins in red bone marrow. On this picture, very nice visible megakaryocyte. You see three oval spaces in photo picture. It's adipocytes. On its slide, blood picture. Very important position, amounts of erythrocytes, reticulocytes, leukocytes, thrombocytes, speed of erythrocytes sedimentation, and hemoglobin. Here you can see main elements amount in blood picture. All amounts is normal amounts. In pathological stages can changes of some elements. Organs of hematopoiesis and immune system to divide on two main groups. Central organs of hematopoiesis and immune system, which include bone marrow, thymus, and bursals fabricius in birds, or aggregates of lymphocytes in a digestive system, respiratory system. Central organs include red bone marrow when providing process of hematopoiesis, and thymus. In thymus provide process of T-lymphocytopoiesis. Peripheral lymphoid organs to divide on three main types: lymph nodes, spleen, and tonsils, and in unencapsulated lymphatic aggregates, lymphocytes aggregates, and provide specific process of antigen-dependent differentiation, T and B lymphocytes. After influence of antigen, T and B lymphocytes go to antigen-dependent differentiation after formation of special form T and B immunoblast cells. In hematopoiesis present specific types of formation of cells and names of hematopoiesis joined with names of blood form elements. Erythropoiesis is formation of erythrocytes, leukopoiesis formation of leukocytes, granulopoiesis formation of granulocytes, agranulopoiesis formation of agranulocytes. Main theory of hematopoiesis includes special knowledge. All form elements of blood form from pluripotential stem cell. Short name CFUS. It's a special cell similar by size and structure to small lymphocyte, and from pluripotential stem cell can form all form elements of blood. Process of regulation of hematopoiesis includes specific colony-stimulating factors. You see names of colony-stimulating factors: erythropoietin, leukopoietin, thrombopoietin. Hormones, variations of its stimulating factors can formed in different types of organs. For example, erythropoietin formed in kidney and thymolene T-lymphopoietin formed in thymus. Students, on next slides, information about changes in period of erythropoiesis from stem cell to mature erythrocyte. Special cell reticulocyte, it's a precursor of mature erythrocyte, has a more large size and include rapidoplasmic reticulum, parts of this micronucleuses. It's a small structures after destroyed of nucleus inside in a reticulocyte and a Golgi apparate. On its cell continua process formation of hemoglobin. Dear students, thank you for your attention. Best regards.